Good morning, family and friends. Let's continue the discussion about ticks and look at the most common tick-borne disease in the U.S., Lyme disease. Lyme disease is reported most often in the northeastern part of the U.S., particularly in Pennsylvania and the upper Midwest states. It is caused by the black-legged tick, also known as the deer tick. The bacterium that the deer tick carries is called Borrelia burgdorferi. According to the CDC, they report an estimated 476,000 cases of Lyme disease yearly. Most people who are diagnosed with early Lyme disease and treated right away with about 3 weeks of antibiotics have a good outcome. But if you do not receive treatment for weeks or months after the bite, Lyme disease becomes more difficult to treat. In order to transmit Lyme disease, the tick must have sucked blood for a minimum of 36 to 48 hours. Within 3 to 30 days after the tick bite, early symptoms can be seen. Symptoms are categorized into 3 stages. Early symptoms of Lyme disease, also known as stage 1 symptoms, include a classic rash, which looks like a bullseye. It can appear anywhere on your body, and the bullseye has a central red spot where the tick bite occurred. The red spot is surrounded by a clear circle with a wide red circle on the outside, and it is called erythema migrans. This rash only occurs in people with Lyme disease. Other nonspecific rashes can also be seen. Additional early symptoms include fever, loss of appetite, headache, extreme fatigue, intermittent migrating joint stiffness, muscle aches, swollen lymph nodes, and intermittent flu-like symptoms. Stage 2, also known as early disseminated disease, can develop weeks to months after a tick bite. Symptoms may include symptoms from stage 1, in addition to other nonspecific rashes and back and hip pain that spreads to the legs. In stage 2, Lyme disease can impact your brain. Some affected individuals report difficulty concentrating and processing information. There are also neurological issues that can arise, such as problems with balance, neck pain and stiffness, severe headaches, muscle weakness, facial paralysis, numbness, pain, and tingling in the extremities, eye pain, sensitivity to light, and possible vision loss. In addition, a host of psychological issues can be seen, including cognitive impairment, such as reduced concentration and memory problems, sleep disorders, irritability, anxiety, and depression, to name a few. Some people may also experience strange sensations like skin tingling or crawling or itchiness all over the body. Other symptoms can include ear ringing, hearing loss, sensitivity to sound, and jaw pain. In addition, Lyme disease can impact your heart, causing chest pains, shortness of breath, heart palpitations, dizziness, and fainting. Lastly, there is stage 3, also known as disseminated disease. This stage can occur months or years later after the initial infection, if not treated. With stage 3, you may have symptoms from stage 1 and 2. The most common new symptom in this stage is arthritis in the large joints, especially the knees. People can experience swelling, stiffness, and pain. It is important to note that not all ticks carry the bacterium, and a bite does not always lead to Lyme disease. Well, that's it for today. See you next week.